evening, everyone who has joined us today for a first episode of Health Tape with Dr. Suleyman Eserdag, who I will introduce in a little while. And commencing with the program without any further delay, I am Dr. Nidhi, Chief Scientific Officer at Stemcell. And may I present you first what IASRM is and who all can join IASRM. So I will share my screen now. Saloni, can I share my screen? Can you give me the rights?
Yes, I am.
Okay. So I hope all of you can see my screen. So IASRM, it's International Association of Stem Cell and Regenerative Medicine. Well, it is the world's leading community for industry specialists, academic institutions, and researchers on the latest about the researches latest in the field of stem cell technology, cellular therapy, and regenerative medicine. It is an independent, non-profit organization that aims to support and raise advancement in stem cell science and its applications to human health. Well, IASRM provides you with an extraordinary community that addresses three key areas of clinical interpretation: academia, regulatory, and commercialization. Through long-term strategic association with science, research organization, academic universities, and industry partners, IASRM drives the advancement of research into clinical adoption and standard of care. The vision of IASRM is to make the association an authority of training and learning for quality advancement of healthcare with innovative regenerative medicine. And in order to fulfill this vision, our mission is to deliver valuable knowledge that is effective, efficient, and respectful for science, medical, and healthcare service with integrity and accountability using both proven, approved applications, methods, and protocol. This is the body, the organizing body of IASRM. We have Prabhu Mishra as President, Dr. Cheryl Parad as Secretary General, Dr. Diana Mihai as Vice President, and Dr. Nidhi Jha as Executive Committee Member. The International Scientific Advisory Board members include the following scientists and healthcare practitioners. Well, why should you join IASRM? We all know that stem cell-based regenerative and cellular medicine is an emerging and exciting area of medical practice. And while bone marrow transplantation has been into practice since the last decade, but now even newer and more diverse forms of stem cell-based therapies are coming up to treat a rapidly growing population of patients across the globe. With these stem cell technology advancements, physicians with academic affiliations may look forward to get acquainted with these technologies and be able to legitimately practice these. So IASRM acts as a platform for learning about these emerging technologies, ongoing research and education. And by joining IASRM, you will get access to all the latest information about stem cell technology and get trained in this promising field. IASRM is a global platform for collaboration alliances for translational research, cell and gene therapy, tissue engineering, immuno and developmental biology. While it also offers the most extensive library of information on stem cell, cellular therapy, and regenerative medicine, and the educational process continues outside, where members also learn from each other via professional discussion forums, local meetups, and global events. Members may get the opportunity to guide new members, participate in the research community, or play a global role at IASRM. This adds to their professional experience and can increase their chances to get a leadership role in the industry. While IASRM offers outstanding publishing opportunities to its members to reach its captive audience in the scientific community. So who all can join IASRM? Anybody who is a scientist, doctor, researcher, entrepreneur into academia, medtech company, or industry working in the field of regenerative medicine, stem cell, tissue engineering, translational medicine, gene and cell-based therapies, or wanting to learn about these, they can join IASRM. So hence it is open to all those who have manifested a continuous interest in any discipline important to the stem cell research area, personalized medicine, and regenerative medicine field, as evidenced by work in the field, original contribution, and attendance at meeting concerning the stem cell research and therapeutics. So IASRM, being dedicated to educate the healthcare practitioners regarding the field of stem cells and regenerative medicine, has two signature courses. First is Fellowship in Stem Cells and Regenerative Medicine. It is a one-year course which offers you 7 days of practical training. Well, you get to have live demonstration on patients, specialty-wise training is available, hands-on trainings for stem cells and regenerative medicine derivatives. It is a one-year course and clinical protocols are provided to all of you, and you're awarded a certificate on completion of courses. The other signature course by IASRM is Fellowship in Cosmetic Gynaecology. It is a 4-month course and includes 4 days practical training. It will have theory sessions along with hands-on training and will implement live clinical applications, scientific sessions, and non-invasive and invasive surgical methods. Well, IASRM is proud to announce its 6th International Regenerative Medicine Conclave, also called Stemcell Express 2021, and it will be held from 10th June until 13th, and will have both the components of workshops as well as the conference. The theme for this year would be multi-specialty applications and challenges of stem cell and regenerative medicine. In order to get more information about this and to register for this conference, you can visit the website stemcellexpress.com or write to us on the email ID at info@isrmglobal.org. And with this, may I please take the program forward? I'm stopping the sharing. Yes. So telling you all about why did we decide to launch HealthTAPE? What is HealthTAPE? IASRM, as I told you, is committed to educate and bring awareness about the promising field of stem cell and regenerative medicine. And hence aligning with this mission and while staying dedicated to maintain the flow of knowledge even through the ongoing pandemic, IASRM is proud to announce HealthTAPE, which is an academic and scientific initiative to learn from the experts in the field. Owing to the fact that the promising field of regenerative medicine is relatively new, leaves a knowledge gap among the population. So HealthTAPE has been launched with the mission to bridge this gap and bring awareness about the potential of stem cell therapy and regenerative medicine to everyone through the leaders. Now, before I introduce Dr. Suleyman to all of you, may I take the pleasure of introducing the founder president of International Association of Stem Cells and Regenerative Medicine and the CEO of StemGen Group, Prabhu Mishra. Well, he has the expertise of working in the field of stem cell and regenerative medicine for the last 15 years, and he is dedicated to bringing this emerging technology from lab to bedside and make this technology accessible by everyone. Now, commencing with this webinar and the special episode of HealthTAPE with Dr. Suleyman Eserdag. He has specialized in obstetrics and gynecology for the last 20 years and is one of the pioneers of aesthetic gynecology in Europe, based mainly in Istanbul and also in Ankara and Izmir. He acquired unique training experiences from some of the world's most renowned experts when aesthetic genital surgery was in its infancy. Through his own pioneering work, artistic skill and focus, he has refined and modified several techniques in order to offer to his patients the most effective treatments and the most beautiful results. His practice is now totally dedicated to aesthetic gynecology and sexual medicine, offering the full range of procedures in cosmetic genital surgery, from labiaplasty and vaginoplasty to complex laser surgeries and non-surgical treatments. He's performed more than 6,000 patients, different kinds of genital operations since 2000, not only for aesthetic, but also for different functional and regenerative purposes. Dr. Eserdag is an active member in various international societies and is a fellow of European Committee of Sexual Medicine. He combines some of the aesthetic genital procedures to sexual therapies for the women who have sexual dysfunctions. And with this, may I please pass on to Dr. Suleyman? Please, sir.
Thank you for a nice presentation. It's my honor to be here with you. And I especially thank Prabhu Mishra, is a very good friend of mine and president of IASRM. You're doing great job. It's very important. The regenerative medicine is an accelerating so fast, and you're doing great job. And it is fantastic to be here, and very honorable for myself to be with you. And I totally support all the job that you do, and I'd like to be here. Thank you again. Yeah.
Thank you, sir. Please continue with the presentation.
Yeah, I can give you some a little bit overview. I don't want to be bored of you. I don't because it's a tiring time. It's busy, after the busy hours. I want to make a light presentation, not like a typical. Let me share my screen. I think it's done.
Yes, it is.
Is it okay? I will be a little bit overview. I don't want to make you bored. So it's just a light presentation for overview on female cosmetic plastic gentle surgery. You introduced me very well. Thank you so much. I'm a specialized doctor from Zeki Altabrak Hospital. Is one of the biggest maternity hospital. I've been working there in IVF, infertility, and perinatology clinics for 5 years. And after this, I reassigned myself, and then I started to work in my private clinics in Istanbul, Ankara, and Izmir. Is the three biggest cities in Turkey. I'm also a sexologist fellow by European Federation of Sexology and European Society of Sexual Medicine, and formerly international instructor of ECAMS. And I am also founder and president of two societies. One is national. This is HERA Vaginismus Treatment Educational and Research Association. The second one is international one, as you know, is ISACS, International Society of Aesthetic Genital Surgery and Sexology. We found ISACS in 2017. Is a unique society totally dedicated to aesthetic gentle surgery, but also we combine sexual dysfunctions, also, mostly in women, but also in men. And we are having some hands-on courses in different countries in the world. This is one of the course in the Vienna, is another course in Vienna in 2017, is in Istanbul. We have hands-on courses. The first aesthetic gentle surgery congress in New Delhi in 2017 with my dear friend, Dr. Navneet Megan. We were together there with the Polish and American group and Indian very good surgeons and lecturers. There have also been too many lectures and hands-on trainers in the Philippines, Indonesia. ISACS has been also affiliated society in IMCAS in Bali for 2 times, and we have also established 2 international congress, one world congress in Istanbul in 2018 and 2019. And the last course, the recent course with my dear friend, Dr. Adrian Gaspa, which is the pioneer in laser treatments. We've been course almost 2 weeks ago. It was very nice. Even though it's a pandemic period, we have good attendees from different countries. We gave surgical and non-surgical procedures. And I like to mention my book is ahead of printing. It will be Female Aesthetic and Functional Gentle Surgery. It will be in Turkish and English. I hope to share with you as soon as possible. And this is one of my motto in the book. The physician who performs aesthetic operation should be like a psychologist during the consultation, with the awareness that each patient is different from the other, and like an artist while performing the surgical art. As you see, we should be psychologists and artists if we are doing this job nicely. I like to mention about Turkey. This is Turkey. We have a long history. We have different parts and different features in different regions. This is Mustafa Kemal Atatürk, the founder of our republic almost 100 years ago. He proclaimed republic in our country and founder of our country. This is Maiden Tower in Istanbul. This is historical part. We have a very long history and very nice lakes, especially in northern part, in rivers, and some of the forests in northern country. We have nice place to see in southern part, nice beaches, nice holiday resorts that we have. And in central Anatolia, we have Cappadocia. You can have balloon tour with between the fairy chimneys. These are the unique stones in the world, and we have the history 10,000 years before Jesus Christ. This is almost 10,000 BC. Is a long history, 5,000 years before the pyramids, and different stones from Pamukkale. This is from the volcanic blast, is a full calcium, and it's a unique part, and hot water, it's thermal water that we have. And we have the beast. This is me. I'm showing somewhere. Where I am showing, it was this year, I was yachting in the coast of Turkey. I was showing where? This place. This clitoris. This is like just I give this name to this interesting place. So this is interesting, just for a joke. And we can enter the cosmetic plastic surgery or cosmetic aesthetic plastic surgery has some surgical and non-surgical parts, as you know, and it is very evolving field of the medicine. As you see here, there are too many reasons in this improvement, in this acceleration. As you see, one of the main reasons is the epilation of the ladies and increasing trend in social media. Everybody wants to be like a Barbie look, and Barbie look vagina is a brand name. So the behaviors of the societies are changing so fast, but it's so interesting. It's affected all globally. As we take all women born with different shape, which is normal, which is abnormal, I think all of them is normal. There is no abnormality. So what do? We do just make them more beautiful according to general characteristic or demand of the people. But if you look at this labia, all of normal, we cannot say this is abnormal or congenitally or acquired problems, but just we are doing this, giving the tissue more beautiful appearance. The people have, especially in Western society, it started firstly in America, and after 2017, it has been accelerated by the laser and radiofrequency treatments in genital area. The last period of this field, and most of the women need to have almost same appearance of the labia. Marking is very important part of cosmetic art. Most of us are gynecologists, so we are not familiar with the marking, but we need to know about it, and it's very important. This is a Barbie look vagina, most of the women need it and demand it. And if we talk about the contraindications, we never do this kind of operations during pregnancy or just after the delivery, and existence of active HPV or HSV or uncontrolled diabetes, morbid obesity, abnormal scarring and calids, psychiatric or severe psychological disorders, malignancy or suspicion of malignancy, mental disorders, and patients with over expectancy. So gentle aesthetic operations increase body image and self-confidence, and these operations are demanded not only aesthetic but also functional, social, hygienic, medical, and sexual reasons. Before the surgery, patients should be illuminated about the advantages, disadvantages, and all the possible complications. You need to involve all the possible complications into the consent forms. Is very, very important for your job. And training before practicing is very important. It's crucial to minimize the complications and ensure patients' satisfactions. Here are my contact numbers and social media. If you have any question or anything, you can write me from WhatsApp, or you can add me from Facebook or Instagram. So I'd like to get in contact with you. That's all that I can do. I can say for this meeting. Thank you, Dr. Corona. I'd like to answer the questions. There can be a lot of questions in mind, but sure. As much as it's available of time, we can proceed with the questions.
Thank you, Dr. Suleyman, for this very short presentation that really encompassed, the basic of aesthetic surgery, and what is normal, what is abnormal. You put it very clear out there. There is no definition that can define it, and it solely depends on the desire of the woman who's undergoing these procedures to really, envisage which kind of shape that they are, they're wanting for themselves. So, like, I have the first question for you that pops up in my mind is, you've treated so many women, like you've conducted these procedures on so many women, and still in our society, these kind of procedures, the aesthetic procedures, they're not, highly welcomed, and they're not really broadly spoken of. So what is the fear in the women? Like, what kind of fear do they face? What do they come across when they want to come for these procedures, but they do not? What, in your experience, can be the reasons for the women which is holding them back?
Yeah. So, Dr. Nidhi, most of the women, especially in this pandemic periods, we multiply our operations 2 times or 3 times. That's quite a lot. It's interesting, but all the cosmetic procedures have been also increased. So it's so interesting, especially in my country or in Istanbul, is too much increase. Most of the women are not aware of their problems. This we aesthetic genital surgery, but it's not only aesthetic is only part, but it can be main. Yes. But we mostly do these operations for functional reasons. They cannot wear the tight pants, or irritation on problem during sexual intercourse, or during peeing. They have so many problems. So they want to be cured. They want to be treated, but they don't know about it. So but it's the public awareness is increasing so fast. So, every woman, especially in last years, in the past years, they're afraid of any procedure in their genital area, as you know, because these operations are not so general worldwide or in their region. So it's increasing. They're speaking with the friends and asking their opinion, and then they come back. But still, there are a lot of women suffering from this kind of problems, and then they are searching too much. I have one of my patients. She's following me for 7 years. She got 3 or 4 times appointment, and then she retreat.
Okay.
So interesting, yeah. But it's humans. I cannot say that there's only one kind. There's not. Everyone has different character. But I can say that it is becoming more normal. If we are going back for 20, 25 years ago, most of the physicians saying like this: if someone having operation or surgery in genital area, firstly they should consult the psychiatrist because of some questionnaire they need to have. But now it's changing. I never send any patient to a psychiatrist if you are some problem in your mind and check it like this. Instead, I do this. We need to be like a psychotherapist with the communicating with the patient and trying to understand her needs. It's very, very important. I think it's the same importance with the surgery.
Right. No, I totally understand, and I definitely agree with you. I think it's mostly lack of awareness among the women that these kind of treatments they're available to not only enhance the aesthetic look but to treat the functionality issues as well. And can you throw some light on how can like the practicing healthcare practitioners, how can they help their patients identify that their needs of taking such kind of procedures? Like, can the gynecologist or any healthcare practitioner do anything on their part, on this part? Yeah.
Sorry, what you mean as any health providers can do this? I didn't understand exactly.
How can they help the women? Like, as you told that there's lack of awareness. So can
Yeah.
the healthcare providers help in this case, like by communicating with the patients or anything? Like, have you had that kind of experience with yourself?
Yeah, I think is the globe is very small. We are living in a small village, and whenever we have something in social media or digital media or on TV, it's patient to patient or from public. It's very distributing very fast, and the behaviors of different societies are almost same, where we become as you know, is a pandemic period start just one person has corona, and as now millions have corona.
Right.
So it's very distributing very fast the knowledge, and it's increasing so fast. There are too many materials that they can go through, and it's increasing. But the main thing, they should decide the doctor. They should decide. They should trust you, and with a good communication. I never try to persuade any patient in my career or in my job. I never, if she came to my office for example, for pap smear test.
Right.
I never try, and with the long labia, I never say this labia need to be cut, because if she has some trouble or she's suffering from this problem, she can consult me. And some of the patients trusting a lot and then say this, doctor, I believe in you, but I'm not aware of the problem where it is. And please go through on my body, on my genital area, and inform me if there's something wrong with me. So you can guide the patient, you can give some idea for them, but I never try to persuade the patient for the operation. This is their idea, but most of the patients come to me for they search too much on internet and social media. I think social media is much more important than websites for today. Facebook, Instagram, especially so WhatsApp is very important. We need to use it. I think it is the best part. And because from the patient, from the mouth to ear is not easy to distribute. Whenever they are happy with the operation, they never talk about this
Yes.
around themselves. They embarrassed. So that's why. But it's spreading out so much, and just we need to make public awareness better, and we need to have good job. If we are doing wrong job, this is very big problem. Everybody is talking about this, and most of the patients have avoidance to have any surgery. This is so it's training is crucial
Yes.
before starting.
Right. So thank you for this wonderful answer, Dr. Suleyman. I have a question from Dr. Dua Saleh. And the question is about what about counseling and outcome after vaginal tightening? And what about orgasm and dyspareunia after it?
After lasers,
After vaginal tightening. So that is the
vaginal
only part.
tightening is
Yeah.
surgical or non-surgical?
Yeah. Please kindly elaborate, Dr. Dua, in the chat box. Surgical.
Yeah. There are also some articles and also our observations that surgical vaginal tightening has a good effect on sexuality. The FSFI scores increase. There are 6 domains in one group of study, I remember, and only the lubrication and pain can decrease because if you are making too much height on perineum, the patient can have some pain, and it can lead to dyspareunia problem, and the other domains increase. But if you are doing good job, I believe in all of the patients are so happy. You're not only tightening the vagina, but you're also changing the angulation of the vagina. After the vaginal birth, especially, it's been angulated, and the reaching the anterior part of the vagina is not so easy, and then it's also is a sexual problem and laxity problem, insensitivity problem, and in for the angulation problem, you can correct them all. So I'd like to have surgery in this kind of patients, especially who need after the vaginal delivery. But if she's not having any vaginal delivery, I mostly prefer laser treatments.
Great. So Dr. Suleyman, I'm going to ask a very basic question to you once again, because this is open to even non-medical personnel. So this kind of conversation through HealthTAPE, we are actually wanting to take the awareness to the general public. So my question to you is about the procedures. So for example, the surgical procedures and non-surgical procedures, what do they look like? Like, does patients experience a lot of pain, and do they undergo anesthesia for surgical procedures, and for how long, and how does the recovery look like?
If we compare surgical and non-surgical, you mean?
Yes, yes, sure, we can do that.
for surgical vagina tightening and laser vagina tightening, if we compare, you mean?
Yes.
Okay. I think this is a nice question, and most of the patients ask for this. I have insensitivity in my vagina, or I have enlargement in my vagina, and I need to be corrected. So, what is the best option? Is surgery or non-surgery? In surgical parts, we have mostly we're doing corporally posterior operations, sometimes anterior, sometimes lateral. In non-surgical part, we have laser, radio frequency, and some of the case we also include PRP in these patients to get better results. So, if there is a vaginal delivery, if there is too much enlargement, I measure it with my finger breadth. After 3 finger breadth in lithotomy position means moderate to severe enlargement. So if it's too much enlarged, and if there's any fascia defect, I mostly do surgery. If she has stress urinary incontinence and cystocele, I do surgery. But if she has no vaginal delivery, or if she is afraid of any surgical intervention, so I proceed with the non-surgical part. But I separate the patient for the indications and also demands. In all of the cases, I do the same thing. Indication and also demand of patient, and also my experience on this practice.
Is there any difference with regards to the results that surgical procedures or non-surgical procedures give? Like, do they give any of the procedures give better results, or they are both the same?
Yeah, if you individualize the procedure to patient demands and the tissue conditions, it's very nice. So
Okay.
it's very satisfactory. But if you, I never do the same thing in all of the patients. I cannot.
Right.
We should be like a tailor. We need to tailor the procedure patient to patient. One size doesn't fit all.
Right. So, Dr. Suleyman, one of the questions that comes to my mind is how, like, the effect is for how long? For example, with respect to non-invasive procedures, the effect obtained would stay for how long?
For laser or radio frequencies, the non-surgical part, everything is constant. It's not permanent. In every treatments, for example, face applications or any procedure other than surgery, have some limits. This is it changes according to your collagen tissue remodeling. So normally and generally is 1.5 years. But if your collagen is going dead or apoptosis so fast, so it can be earlier. For example, not a good nutrition or smoking too much cigarettes like this. But if you have a good health situation and good diet and good sleeping without any stress you have, so it can extend to 2 to 3 years. But in surgical part, for example, surgical vagina tightening, I think it lasts a lot of time, a lot of years. Sometimes it's permanent. I call my patients, some of patients consult me 7, 8 years or 10 years later. I examine the vaginal girth and it's so okay, it's nice. So it's good. So it depends on your tissue conditions, your genetic coding is very important. and also your lifestyle, which determines the outcomes of the procedure.
Great.
It's very interesting. One of a few patients that after labiaplasty, I mostly do curvilinear labiaplasty. A few patients after 2-3 months, and one of these 8 months later, is a sagging or enlargement in labia again. It was so interesting for myself, for my experience. I've seen a few patients after labiaplasty as also enlargement in labia. This is I'd like to share this experience of mine.
Okay, great. So what do you do? Like this came as a follow-up question. What do you do in such cases? So you found that the labia was further enlarged even after doing labiaplasty. So would you recommend doing it once again, or how do you counsel the patient?
Yeah, if I don't do it again, they kill me. Is because they are the main reason they come here with the small labia is a barbelloc labia. Most of is I think is 95% of patients demand it. So I should do this, but I wait at least for 3 months after the procedure for better healing, wound healing. So I do again. This is a must.
Okay, great. So what would be the minimum age for women who want to undergo these procedures?
Yeah, it should be 18. Especially, I want to recommend the young doctors, young colleagues. Please do not this kind of operation or labiaplasty, labia minora or majora. Do not do these operations below 18 for aesthetic reasons. If she has some medical reasons, which is quite rare, like difficulty in urination or having some too much irritation depending on friction, yes, you can have this. But I hear some of the colleagues do this operation like 12 years old, 11 years old. Please do not do this, because we need to wait until the sexual development is complete, which is 18. Okay?
Great. So Dr. Suleyman, what about the regulation of the cosmetic gynecology procedures? As we all know, there are no stringent, guidelines for the protocols. Every protocol, varies with the doctors who's practicing it. So, where does this all come in when you are actually practicing these procedures on the patients?
I think we should do this all together. As a cosmetic gynae expert, we need to come together in aesthetic and functional and regenerative part, and we should have protocols for these patients, because as you know, there's a few society almost against aesthetic genital surgery, FDA or ACOG or some of the other for Canadian, Australian societies follow them. So we need to have more scientific data for this. Still, we are lacking data. And then we need to move together to build some algorithm about these cases. Otherwise, it will be underground procedure and be blamed by some of the societies we will have. We will be target of bows and arrows of different societies. We shouldn't do this. We need to move all together and have this algorithm. Yeah, there's also regulations in Turkey, but not in for cosmetic gynae, but for plastic operations it is. And in our country, if you are doing this job like plastic surgery, you alter the organ. It doesn't matter it's a face or genital area. You alter the appearance, look of the organ. So this is if this is not medical indication, it is for aesthetic concern. So if you're doing this and if you're having a malpractice or complication on this, you need to pay for too much penalty. So we need to be very alert, very patient selection is very important. And also we need to keep on regulations and need to have also good communication with the patient. Good communication avoids you from too much trouble from the patients. Follow up the patients is very important. I operate one third of my patients who consult me for aesthetic genital surgery. I select patients. Whenever they come, I select you from internet and social media, whatever they say me, but I say, yes, this is okay, but I also need to select you if you are suitable for this operation or not. We need to distinguish body dysmorphic disorder or any psychiatrist problem, any over expectancy patients. We need to separate them. If we are doing this, we need to select our patients.
Great. And with this, I think, Dr. Suleyman, would you throw some light on your view of the future perspective of this field, of cosmetic gynecology field? What do you foresee about this field in the future? What is your take on that?
Yeah, I think evolving so fast, and I think we are in the beginning of the cosmetic gynae. We are in the infancy of the cosmetic gynae. Believe me, after 10 years later is not so long, more than half of the women will demand it. The life expectancy is increasing. The anti-aging, general anti-aging treatments are increasing so fast. Sexuality, sexual gratification, sexual problems being emerged and demanding much more. And sexuality is one of the main reasons of aesthetic genital surgery. So that's why in 10 years, it will be like Botox or fillers or like this in the face. And people come to our clinic demanding laser or RF or any operation. I believe in so. So we should get prepared for this feature and enhance our abilities. That's why it's very, very important. And I think there will be too many doctors involved in this field, and we should be very fast and to be pioneer.
Right.
To be pioneer. Yeah.
Great. In this regards, like you put it very, very clearly, since it is just in its infancy and it has a lot of potential, you will need more trained professionals to practice these procedures on the patients. So, would you enlighten our audience who's been, listening to us about the educational programs that are there? For example, even IASRM offers two signature programs: fellowship in cosmetic gynecology and fellowship in stem cell and regenerative medicine. The importance of these programs for the healthcare practitioners who are interested to take up these procedures in their practice. So can you just kind of, say what you feel about these programs that are there, the educational programs?
I think it's important. The IASRM very very good society, especially on regenerative medicine and cosmetic gynae. I think you are doing good job, and I think the doctors need to attend your program, especially to be trained in SVF, stem cells, HA, hyaluronic acid treatments, regenerative medicine is very, very important because this part is aesthetic, sexual, and regenerative medicine is some of them is some merging points on it. So it's very important, and I recommend all the doctors to attend the courses of IASRM and have been trained. It's very, very important, especially the stem cell treatments.
Right. No, thank you so much, Dr. Suleyman, for bringing this up. I have a question from Dr. Alina. Hello, sir. It is a pleasure to meet you. Thank you for this wonderful introduction to gynecological cosmetics. As a recent graduate of the Fellowship in Regenerative Medicine and Diploma in Gynecological Cosmetics in India, under the guidance of Mr. Prabhu Mishra, whom I thank very much for this wonderful experience in the idea of deepening further and learning the techniques very well, what can you recommend me to do in the future? So she has taken up the courses, she has taken up the Fellowship in Regenerative Medicine and Diploma in Cosmetic Gynaecology, and she wants to know what do you recommend for her to do well in this area in future?
Yeah, I think this field is moving so fast, and there are different sides. I think it's a huge or broad spectrum and different kind of different societies doing different job. For example, I've been doing this in this field almost for 20 years. I start all on by myself. So you're lucky, Dr. Alina. I all start by myself, discover the vulva, trying all on myself, and then I gone to United States with different mentors, Dr. Allen said, Dr. Adam Ostrozensky, Professor Ostrozensky, like this, or ECAMS. So trying to discover different instructors or trainers, what are they doing? So whenever you have different programs, you can calculate, you can do it in updated your route, what to do. But I think the field is evolving so fast. Getting one diploma or certificate program, I think, is not enough. For example, I'm dedicated for 20 years in cosmetic gynae, but I also trying to learn something from an expert. I cannot stop because everybody has different techniques and different tips or tricks in the procedure. So I try to fix it into my job. So that's I recommend. Yes, you can do very nice job, nice operations, but do not stop. Try to search in different mentors. I recommend so.
Right. No, that's a beautiful answer, I must say, Dr. Suleyman, and I'm certain Dr. Alina found it equally valuable. And she's saying thank you very much. Dr. Suleyman, and I would request the audience at the same time to post your question in the chat box if you have any. But my maybe last question from my end to you would be, you started doing cosmetic gynecology like way back in 2000s when hardly anybody, I think, even heard of it. So what, in that time, what encouraged you to contribute to this field?
Yeah, I started in 2001. I never seen any mentor. I never seen any practice on this. Even, do you believe me, the labiaplasty term, I think about this. What can be this term? I started in a rural area, in a village woman. I try to cut the labia. I don't know why, what matter encouraged me this, but some people are irritate the labia, irritation on labia, and then demand this. This I can do this, just do this. I like plastic surgery, aesthetic concerns too much. I start do this like experimental. So after this, why don't I use it in my website? This kind of operations. I have built a website in 2002. It was very early, but there are not too many internet users in this time. I said, oh, what should be the terminology of the operation? This is labium, this is plastic operation, so it should be labiaplasty. So I wrote it. It was very, very, in the beginning, I tried all on myself. After doing this, almost more than maybe 10 years, the first Congress of Cosmetic Gynaecology has been held in Istanbul. So I was lucky. I've gone there. Dr. David Matlock, Dr. Troy Halpern, Mike Schamberg, very good lecturers that I had, and I have opportunity to meet them and ask questions. And I have also a small oral presentation in this Congress, and it pushed me ahead for trying to do best and searching for this. But it was not, whenever I remember, whenever I firstly cut the cultural hood area, I was afraid. How can I do this? If she lose the sexuality, what can I do? But if I'm not doing this, I cut only labia, it doesn't look nice, smart. It's not even. So I should do something here, need to cut. But I never seen any people or any doctor cutting the labia or cultural hood area. It was so difficult to be starting as a pioneer in this field, but now it's so easy. There are too many courses, too many mentors, too many books, and so we are lucky right now.
No, this is amazing, Dr. Suleyman. Thank you for sharing your experience as a pioneer in this field. And definitely the message out there is loud and clear. Do not stop, do not be fearful, keep learning and stay informed.
Yeah,
So,
yeah,
right. May I request Mr. Prabhu Mishra, Dr. Prabhu Mishra, to please say a few words. So you need to unmute, Dr. Prabhu.
Yeah, thank you, Dr. Nidhi, for this wonderful program today. And first of all, I'd like to thank our dear friend, Dr. Suleyman, for this wonderful experience and journey. And in a nutshell, I'll tell, see, leader stands alone. And it's, of course, because it's not easy to bring an innovation. And whenever you are bringing something new to the platter, the first thing comes is non-acceptance. Oh, what is this? Oh, this is nothing. So this is what people first reaction comes, and after that some acceptance, and then like, okay, you create your followers. So this is what the journey of life, and this is what the leader's journey. And whenever someone is the winner, then they create the followers. So this is what I can say about dear friend Dr. Suleyman. And really, and basically here I'll tell you for all of you, this objective behind this health tape is brings this kind of innovative talks to all of you from the experts, not only regarding to the cosmetic gynecology or stem cells, from the various other field of healthcare. Many are still like immunotherapy is another area, gene therapy, genome editing, many translational science are coming into the picture. So these all things we are bringing here on this. So Health Tape will bring many this kind of innovative lectures by the experts. And I'm extremely thankful to Dr. Suleyman here for today's. And here, Dr. our Vice President, Dr. Diana, have also joined the panel. Thank you, Dr. Diana. And wishing you happy Easter, especially for Orthodox in Europe. And thank you again, Dr. Suleyman, for your wonderful contribution to the program.
Thank you so
Thank
much.
you. Thank you so much, Dr. Prabhu. Before we wrap up this session, may I present electronically a certificate of appreciation on behalf of the entire team of IASRM to Dr. Suleyman.
Thank you so much. Looks nice.
Thank you so much, sir. Thank you so much for spending time with us today and sharing all your wisdom and knowledge about the field. And we look forward to keep having these sessions with you in future as well. As the field progresses, as the new knowledge emerges, we definitely look forward to keep learning about it from you. And with this, may I take the pleasure of thanking everybody who's been able to join us for this session today, and follow our social media website, follow IASRM Facebook group for updates about the upcoming sessions and webinars, upcoming health tape session, upcoming publications that we are going to publish through IASRM. So for anything latest in the field of stem cell and regenerative medicine, kindly follow IASRM Facebook page. And with this, thank you everybody, and bye-bye.